Welcome everyone to another masterclass, and this session is going to be on magnesium sulfate for fetal neuroprotection. I call magnesium sulfate as a pluripotent drug because it has got a lot of different function as far as obstetrics is concerned. So it can be used for fetal neuroprotection when the preterm delivery is anticipated. It can be used for prevention and management of eclampsia, and it can be also used for tocolysis. But we have got better alternatives as far as the tocolysis is concerned. So it is not a very popular drug if we consider tocolysis. But definitely it's a very good drug for fetal neuroprotection. And in this session, we are going to discuss about the mechanism of action and the timeline until which period of gestation we can use magnesium sulfate for fetal neuroprotection, and also the indication of this particular drug. So let's get started. So as always, we are going to start with the basics. Now, first, we're going to discuss about the indications. Now, if you see the slide on your right hand side, you can see this. So magnesium sulfate can be administered as a fetal neuroprotective agent in anticipated preterm birth. It can be a case of preterm labor or a PPROM, right? And the birth is anticipated before 32 completed weeks of gestation to decrease the risk of cerebral palsy. So the main benefit of using magnesium sulfate as a fetal neuroprotective agent is to reduce the risk of cerebral palsy in preterm babies. Now, if you see the timeline when it can be used, so it can be used for a period of gestation somewhere between 24 to 32 weeks. So if at all in this time period, we anticipate a preterm delivery, then we can definitely use magnesium sulfate as a fetal neuroprotective agent. Okay, and the main benefit is to reduce the risk of cerebral palsy, as I already mentioned. Coming to the mechanism of action of magnesium sulfate as far as the fetal neuroprotection is concerned, the most important mechanism, right? The magnesium sulfate has got a multifaceted mechanism of action as far as the fetal neuroprotection is concerned. Out of all this, the elephant in the room is this first one, that is the blockade of the NMDA receptor. We all know that the NMDA receptor in the brain is for an excitatory neurotransmitter called glutamate. So if you block this receptor, the glutamate can no longer bind with it, and this is going to inhibit the neural impulses, and that decreases the excitotoxicity of the nerves of the brain, okay, thereby protecting the brain against cerebral palsy. So this is the number one mechanism. Number two mechanism I want you to look at here, it has got a membrane stabilization property. How? Because magnesium sulfate is divalent just like calcium, so basically it competes with calcium for influx into the cell, and as it decreases the calcium influx, it decreases the membrane excitement, and thereby having or exhibiting a membrane stabilization. Number three is this one, right? It has got anti-inflammatory effect as well, okay? And magnesium sulfate basically inhibits a lot of inflammatory cytokines, namely TNF alpha and interleukin 6 and interleukin 1. All right, and because of this, right, anti-inflammatory effect of magnesium sulfate is also used for dressing of sometimes severe bulbar edema and even bipedal edema in a patient with severe preeclampsia. Okay, next is number 4. Magnesium sulfate causes cerebral vasodilation, or should I say the vasodilation of the, usually especially the head and the brain. Okay, and thereby it increases cerebral blood flow, further exhibiting the cerebroprotective effect. Okay, and decreases the risk of ischemic damage to the brain, and inhibiting the occurrence of cerebral palsy. And as the magnesium sulfate exhibits some sort of vasodilatory property, that this explains why when you give a patient magnesium sulfate, she complains of hot flushing and sometimes headache and sweating. All right, this is because of cutaneous vasodilation of the head region. Okay, and also it causes cerebral vasodilation. Magnesium sulfate will come over here, number 5. It also exhibits some sort of antioxidant effect. It decreases oxidative stress and increases the mitochondrial stability. It basically inhibits the free radical induced DNA damage and mitochondrial damage. So these are like 5 different mechanisms by which magnesium sulfate act as a fetal neuroprotective agent. I hope it makes sense. Out of this, the most important are this one and this one. All right, so it basically blockade of the NMDA receptor for glutamate and the membrane stabilization, and also anti-inflammatory effects as well as antioxidant effect. All right, and thereby by all of this mechanism, it decreases the risk of cerebral palsy and decreases the risk of the ischemic injury of the brain, and it's basically improve the neural outcome, right, to a great level as far as the cerebral function is concerned. Now, last point is to discuss about the dosing, how to administer it practically. So let's talk about the doses of magnesium sulfate as it is given for fetal neuroprotection. So I want all of you to focus on this slide, please. Now, if you can see, so we give a loading dose of 4 gram, right? We give a loading dose of 4 grams slow IV over 20 to 30 minutes. So it's just like the loading dose of the pre-judge regime if I consider the IV component. Okay, so magnesium sulfate 20%, 4 gram over slow IV over 20 to 30 minutes. Okay, it is followed by magnesium sulfate infusion with the help of infusion pump, and it is given at a rate of 1 gram per hour for 24 hours or until delivery. Okay, which one is latter? So this is very important.